We are surrounded by an invisible, constant siege. Between global travel, urbanization, and a shifting climate, humanity is exposed to a rapidly multiplying array of viral and bacterial pathogens. When we think about fighting these diseases, we picture this: doctors, medications, and high-tech monitors. Hospitals deal with the failure of prevention. By the time a patient arrives, the primary layers of defense have been bypassed, forcing doctors to fight a reactive war against the damage already done. Our true frontline is public health. This is a massive, highly coordinated system of invisible barriers designed to do one thing: break the chain of transmission long before a pathogen ever reaches a human host. By intercepting threats in the environment, we reduce the burden on our clinical systems, shifting the focus from treating the sick to maintaining the health of the community. The oldest and most critical layer of this defense is also the most basic: water, sanitation, and hygiene, known as WASH. This flowchart illustrates the fecal-oral transmission pathway. It maps exactly how pathogens, like cholera or soil-transmitted helminths, travel from human waste into the soil, water supply, and ultimately into the food we eat. To sever that specific pathway, we build physical barricades. Large-scale water treatment facilities like this one, combined with household water filtration, intercept the pathogens before they ever reach the tap. Soap molecules wedge into the virus's lipid envelope and pull it apart, destroying the pathogen structure on contact. Without clean water and basic sanitation in place, the most advanced medical treatments struggle to make a dent in community infection rates. Sometimes a novel respiratory virus emerges, and we don't have a vaccine or a specific treatment ready. In that gap, we deploy non-pharmaceutical interventions, or NPIs. These are immediate, stopgap measures designed to starve the virus of new hosts. At the personal level, these are everyday preventative actions. Staying home when you feel sick and covering a cough limits how far infectious droplets can travel. When local actions aren't enough, community-level NPIs step in to alter human geography. By emptying streets and reducing social density, we remove the close contact that respiratory viruses require to jump from person to person. This looks like dismissing schools temporarily or enacting broad telework mandates to keep millions of people out of shared indoor spaces. These preventative measures do not actually cure anyone. They buy us the months we need for scientists to develop pharmaceutical solutions. Once developed, vaccines act as our primary prevention. They are a biological shield, constructing internal walls against the infection before it takes hold. But a biological shield has a major vulnerability. It is entirely useless if people refuse to use it. Vaccine hesitancy, fueled by misinformation and a lack of trust in institutions, creates a massive gap in community immunity. This line graph maps vaccine uptake, demonstrating how behavioral science steps in. Notice how the flat line angles sharply upward right after targeted health literacy campaigns and digital outreach begin. By addressing community concerns directly, public health workers can shift mindsets. Engineering a medical breakthrough is only the first step. Behavioral science is the bridge required to turn a laboratory success into actual widespread population immunity. Even our best cures have an expiration date. When exposed to antibiotics, some bacteria mutate to survive the stress, rapidly multiplying to create a new resistant strain. This is antimicrobial resistance. To combat this, public health uses quaternary prevention. This is the practice of protecting patients from the negative consequences of unnecessary medical interventions. Stewardship programs drive this approach by curbing the misuse of antibiotics. They work to ensure these life-saving medicines aren't prescribed for viral colds, where they offer no benefit. If we want to maintain our pharmaceutical arsenal for the bacterial infections of tomorrow, we have to become highly selective about how we use those drugs today. None of these localized strategies work without a global view. Command centers track infectious disease maps in real time, relying on an interconnected surveillance network to spot outbreaks the moment they begin. The One Health perspective shows human, animal, and environmental health are inextricably linked. Looking deeper into these intersections reveals the root causes of disease spread. Factors like income, housing, and climate directly dictate a community's vulnerability. This global chain of defense relies on individual participation. Every time someone washes their hands, stays home when sick, or follows a prescription correctly, they serve as the vital links that keep the collective shield intact.